Hi, I'm Diana. I'm an RN care manager here on the orthopedic unit. And my role here is to really help you finalize your discharge plans. We try to come in and talk to patients within 24 hours of transferring out here to the orthopedic unit. We will do an assessment. We'll talk about what kind of care you have at home. Do you already have certain durable medical equipment? Is your house difficult to get into? We can work with the therapist to make sure that we meet all those needs. Most patients will go home with their family and outpatient physical therapy. However, based on the recommendations by your physical therapist, some patients will need home health physical therapy, or they may need to go to a skilled nursing facility for a short rehab stay. The average length of stay in a skilled nursing facility is about 14 days.
But we really would like to send you home. And if for some reason, when you go home, you might need home health physical therapy, but please know that for our knee replacements, you're going to need extensive physical therapy after discharge, so it's real important that you plan that prior to your surgery. On the day of discharge, you are going to finish up your physical therapy session. We're going to go over what's called your after-visit summary, which will list your aftercare for your hip or your knee replacement.
Hi, I'm Laura, one of the night nurses over at Providence. I'm going to go through some discharge information with you. You'll be getting a discharge summary, which is a group of paperwork that you'll be taking home with you to give you some background information, so if you need it, the resource is right there. So some of this information is going to include what you will be doing at home, whether it's the medication you're taking or if it's to elevate or ice. It'll also include follow-up phone calls, when to call the doctor, whether it's, if you have a temperature, if the wound itself is leaking or draining, if it smells funny, if you just feel uncomfortable, if you think there's an infection going on, please call the doctor right away. However, if you have chest pains, if you have shortness of breath, if there's a really high fever, call 911 and get it checked out immediately. So upon discharge, you'll be receiving this packet with all the information in there. In addition to that, we have another form that talks about your medications, why you're taking it, and any interactions you might have. A lot of medications do cause nausea, vomiting, and intestinal irritation. So it's a nice form that you have on hand.
When you are discharged from the hospital, it's really important to know that the program manager, myself, will be giving you a discharge phone call within about 5 days of discharge. And this is just a great opportunity for me to touch in with you to see how is your pain being managed. Are you moving around okay? Did you get your physical therapy appointments set up if you happen to be a knee replacement? Do you have a follow-up appointment with your surgeon? Are you having problems with constipation? Are you on a blood thinner? There's a couple other questions that I'll ask you. It's just a real quick touch-in just to make sure that you're doing okay. I usually call Monday through Friday during business hours. I usually don't call during the weekend or during holidays. And I also don't leave any messages on your answering machine because I really want to do a touch-in with you. So I try 3 attempts over a couple of days. If I can't get a hold of you, I'm not able to get a hold of you. But I certainly hope that after you are discharged home that we can connect at least for just a few minutes so I can make sure that you're doing okay and that you're safe at home. So I hope these videos have helped you understand what the expectations are for your surgery before, during, and after. And I hope that it's answered some of the questions that you might have. But with that being said, if there are any questions or concerns, please don't hesitate to talk to your nursing staff, your physical therapy or occupational therapy. And on behalf of the Providence orthopedic team, we thank you for choosing us for your total joint replacement.
Hi, I'm Katie Hutchinson, Executive Director of the Providence Community Health Foundation. We're very proud to provide these videos to you. If you'd like to join us in the foundation and the work we do, please let us know. Grateful patients are the source of the gifts that make these things possible. Thank you.